Hello, Dr. David Hornbrook again for another episode of View from the Other Side of the Bench. As most of you know, I play two roles in my life. I'm a clinician, my dental practice in San Diego, and then also I'm the clinical director of education here at Utah Valley Dental Lab in Provo, Utah. So I look at everything from both sides of the bench. Today's episode, we're going to spend some time with Ed Peay, who's our digital designer and the manager of our digital department here at Utah Valley Dental Lab. Glad you could join us here.
Thank you.
We're going to talk a little bit about digital impressions and the advantages. And obviously Ed is doing this all day long, and he can certainly give you more input than I can. But we're finding doctors are really appreciating not only the fit, but the lack of adjusting, especially on the occlusion, when they're sending digital impressions and the whole casework or the workflow is done digitally without a model. And the cool thing about that is, well, first thing is, why do we need a model anyway? But the nice thing about not having a model and having the accuracy of digital dentistry is we get a better fitting restoration, we get better occlusion, we get better bites because that's done digitally in a static bite, and it's less expensive. The fact that the lab is not required to make a model, literally it's $25 off the normal fee, so there's a huge advantage of that. So Ed, let's talk a little bit about this, because you know some of my pet peeves, and you deal with it all the time, is marginal accuracy.
Yes.
Right? And I get that as a clinical doctor. You know, sometimes it's difficult, or sometimes we get a little lazy and don't pack cord, and I hate to admit that happens, but we see it all the time. And you know, we have great marginal trimmers when we have stone models down in the model room, but they're looking at 10 to 20 power microscope to try to read your margins. And the nice thing about this, I think this is a really good example, Ed, is, you know, instead of 20 power, you know, this is black and white, but if we look at that, and you know, right in here we see a margin, then maybe we can read, kind of, right?
Yeah.
Where you can let's blow that up and just see how.
So that's.
So you mark the margin.
When we can't see the margin, especially where it meets the tissue there, when it's colored, can see a transition and actually mark the margin better.
Okay, and not all the systems are colored. We have the Sirona system, we have the Trios, which is actually our favorite as far as the images coming in. And then we have, you said Carestream is coming out with their color version.
Yes.
And I think PlanScan is as well with their Emerald camera. It is nice that we can see tooth colored in pink. So in those areas where we can't read the impression quite as well as we would like, and we call the doctor, and the doctor says, make it work. You know, we can even bring how much can we enlarge that?
This is just a screenshot, so I
Oh, okay. And you can enlarge that so you can
Yes.
see small little areas, and we can see pink tissue and dent and shaded tooth. It's easier to mark those margins. You know, the other thing, and I want you to bring up a digital bite, is one thing that we see very, very common, especially on when the restoration is most distal extension, whether it be a bridge or a single unit, especially if the doctor uses a triple tray, which they do all the time, is the patient doesn't always bite correctly. And we've all had that scenario, and the model room tries to articulate that as well as they can with this little tiny plastic triple tray, but those are the ones we have to adjust most. And the nice thing about this is the fact that it's a static bite. The patient bites down, you can look in there and you can say, yep, it's there, and you take a digital bite, then we get a very accurate mounting. And what we found, and we've really noticed it with some doctors that just recently went digital, is the adjustment is none, really. Very minimal to none. Would you agree with me on that?
Yep.
I mean, we're seeing doctors, and there's even some good studies on that we're getting up to 60% less occlusal reduction when it's digital. And again, we could print a model, but why do you want a little plastic model when you can save $25? So, you know, we've all scenario like this, and you know, I am not an advocate of plastic triple trays for final restoration, but we see it all the time. We've got this flexibility. We only have one tooth, two teeth on one side and one tooth on the other side of that restored tooth. We don't know if that patient bit down accurately or not. If they didn't, and we don't really see that here, then we try to hand articulate this, but it doesn't always work, especially if there's some distortion, and that's when we get restorations that can be high and take time for you to put in. And again, most distal extension is the most important. So it's very exciting. Is there any input? Where do you think we're going with this? I know we're having more doctors, obviously, send us digital impressions because they're more accurate and we're getting them more affordable. Where do you think we're going with this?
For a lot of the single restorations, especially digital, I think that I've heard nothing but positive feedback from the doctors. We've had several doctors that send in traditional impressions, and we've had issues here and there, and we've tried to resolve them. They've actually bought a scanner, and through this process, now we're hearing that they have no adjustments, they're happy. So as a digital manager, it's a great thing to hear every single day that things are going in within 5 minutes and they're done.
Yeah, I agree. And I did a survey with Master Ceramics about 2 years ago, and again, things have changed, where I just asked them 2 questions. If you had a great doctor and they knew how to take digital, they knew how to take polyvinyl, which would you prefer? Digital. And they all said digital. And the second question was, which do you think is more accurate? Digital. So, if we think again how expensive even an impression is, impression material, time consuming, patient doesn't like it. If we can go digital, it's easier for us on this side of the bench, clinical side of the bench, and then our ceramist or our digital manager is saying it's better on this side of the bench. It just makes sense. I hope that helps. You can always call Utah Valley Dental Lab, ask for Ed. If you have any questions about which scanner to buy, how can I be a better digital dentist, feel free to call.
Thank you.